Food poisoning during pregnancy is a type of infection that can occur when you eat contaminated food. Symptoms can range from mild to severe, and they can include nausea, vomiting, and diarrhea. Food poisoning is particularly dangerous for pregnant women because it can lead to miscarriage, stillbirth, or preterm labor. If you think you have food poisoning, it's important to see a doctor right away. You may need to be hospitalized so that you can receive fluids and other treatment. Pregnant women who experience food poisoning should also contact their healthcare provider right away. Types of food poisoning during pregnancy. There are many different types of food poisoning during pregnancy. Bacterial food poisoning. This is the most common type of food poisoning. It happens when you eat food that has been contaminated with harmful bacteria, such as E. coli or Salmonella. The most common type of bacterial food poisoning is caused by Listeria, a bacterium that can be found in unpasteurized dairy products, raw meat, and smoked fish. Viral food poisoning. Viral food poisoning during pregnancy can be a very dangerous thing. There are many different types of viruses that can cause this, and the severity can range from mild to deadly. If you are pregnant and think that you may have contracted a virus, it is important to seek medical attention immediately. Many times, these viruses can be passed on to the unborn child and cause severe birth defects or even death. The best way to protect yourself and your baby from viral food poisoning during pregnancy is to avoid all contact with contaminated food or water. If you must eat or drink something that has been contaminated, make sure to cook it thoroughly first. Also, be sure to wash your hands often and avoid touching your face. If you do start to feel sick, contact your doctor right away. Parasitic food poisoning. Parasitic food poisoning during pregnancy can occur when a pregnant woman ingests food contaminated with parasites. Parasites are tiny organisms that can live inside the human body and cause illness. Some common parasites that can cause food poisoning include Giardia, Cryptosporidium, and Toxoplasma gondii. These parasites can be found in undercooked meat and poultry, unpasteurized dairy products, contaminated water, and raw fruits and vegetables. How to treat food poisoning during pregnant? There is no one definitive answer to this question, as the best course of action will vary depending on the severity and type of food poisoning experienced. However, some general tips that may be useful in the case of food poisoning during pregnancy include: drink plenty of fluids, especially water, to stay hydrated. Avoid dehydration by consuming small amounts of fluids often. Try to eat small meals or snacks every few hours, rather than large meals. Choose bland, easy to digest foods such as rice, crackers, or toast when possible. Avoid dairy products, caffeine, alcohol, and spicy foods. Rest as much as possible. If you vomit frequently or have diarrhea, take care to replace lost fluids and electrolytes by drinking sports drinks or oral rehydration solutions, ORS.